guys, welcome to OSCElink. So in this video, we're going to speak to you guys about how to take a good history in your OSCE examinations. So OSCE is short for Objective Structured Clinical Examination. So here are a few questions commonly asked by students. What are OSCEs? How do they work? What stations are there? And what skills are being assessed? So on top of your coursework and written examinations, OSCEs test your practical and clinical skills and your communication skills. OSCEs are conducted at all medical schools in the UK, and they occur in any year. They can be summative or formative, and it depends on where you're based for your training. The stations themselves are timed, usually 5 to 10 minutes, and you do get given 1 minute reading time prior to entering the station. There can be multiple stations in a circuit in a day, and there can be multiple days in which you sit your OSCEs. In the room itself, there could be professional actors, other medical students, or volunteers, so be expecting other individuals in the room to go into. In terms of the stations themselves, there could be a huge variety of stations, multiple conditions or scenarios which can come up. So therefore, it's important to expect the unexpected, conditions which you've not covered in great detail, or conditions or scenarios which you've never encountered before. And only by attending sessions or webinars, including OSCElink, practicing with your peers, friends, colleagues, that you do come across and be exposed to such scenarios and conditions. Practice makes perfect. So what skills are assessed? So communication skills are vital. It's important for good history taking. It's important to be able to explain to patients concepts, and also important when you break bad news to patients. Examination of patients, using a structured, methodical approach, having good time management skills and being organized. It's important, managing your time, your 10 minutes in the station, asking all the questions that are necessary for you to reach your diagnosis and then form a management plan. So here's the general format of OSCEs. So initially, you get time given to you to read the station and the instructions. Then you would move on, and then you would essentially take a good history from the patient, or you may have to examine the patient, or both. And then you would summarize to the patient, thank the patient. And you may also need to summarize to the examiner. It's important to double check whether you need to summarize twice or just the once. So there's no clear structure to the OSCE. So essentially, it's about finding a method which works for you, and that comes with practice. So in this talk, we will share with you guys what we think is a good structure for you guys to use during our sessions, and also during the OSCEs as well. So initially, you would introduce yourself, and you would check with the patient their name, their age, and obtain consent for you guys to take a history or to examine the patient. Then you will explore with the patient their presenting complaint. This could be breathlessness, headaches. Here you give the patient time, ideally a minute or even more, for them to discuss with you their worries about what's going on and the symptoms that are bothering them. After this period of time where you listen, you then explore with the patient the history of the complaint. For chest pain, for example, you would ask the patient the site of the pain, the onset, and the character of the pain. Then after you have more details about their complaint, then you would move on and explore other symptoms, other body systems as well, to rule in and rule out the differentials. You would also ask the patient about B symptoms. So these are cancer symptoms, including fever, weight loss, night sweats, fatigue. So this is an example of the Socrates approach you would take for a pain history. So site could be described as being central. Onset could be either chronic or acute. Character could be dull, tight. Radiation, whether pain goes down to the left arm or up to the jaw in a heart attack. So the symptoms. So this could be other symptoms like nausea, cleverness, short of breath. Timing. Is it brought on by exertion? Is it worse at night? Is it all day? Is it constant? Exacerbating factors. So essentially by exertion, or relieving factors, whether it's relieved by GTN spray, or whether it's relieved by rest. Severity. So here you would give the patient a scale of 0 to 10, so, with 10 being the worst pain they've ever felt. Can you be able to rate the pain for me out of 10? So then we come on to exploring the past medical history, surgical history, drug history, family history, and social history. So just to give you guys the important aspects of this. So for the past medical and surgical, you would ask them about admissions to hospital, previous illnesses, previous surgeries they've had. For the drug history, whether it's prescribed drugs, illegal drugs, and over-the-counter drugs. It's important to ask about allergies, something that's commonly missed questions. Then you would explore the family history of the condition that you may think is going on, but also family history of more chronic conditions, heart attacks, strokes, diabetes, high blood pressure, and so on. Social history, you would ask them about things at home, who they're living with, are they dependent on anyone, the financial situation. So then we move on, finally, to lifestyle, ideas, concerns, expectations, and a summary. So for lifestyle, there's a good mnemonic: lost, living situation, occupation, smoking, alcohol, and drug use, travel history. For ICE, ideas, concerns, expectations, it's definitely a mark in most OSCE history taking. So therefore, it's important to be able to ask exactly what is worrying the patient, their concerns. And then this allows you to have empathy and ask more relevant questions to the patient to be able to get more details from the patient and build the report. And then after you do this, you would also summarize as well at the end of any OSCE. You would thank the patient, ask the patient if there's anything else that's missed or anything else you would like to let me know. And after this, then you would explore the differentials with your examiner and answer any questions that somebody may have. So that's the quick recap of what I've spoken to you today about. So please feel free to use this as a rough guide to your history taking. It's something that works and will be more than enough for you guys for your revision and for your OSCE examinations to use. So I would like to speak to you now about the different types of questions. So questions are powerful. So there are two types, so open and closed. So initially, open questions are used more commonly. Then at the end, closed questions are used. So open questions, they leave more room for the patient to explain themselves, while closed questions tend to elicit shorter answers. So you can be creative here as well, and you can ask a closed question followed quickly by an open question. So for example, do you experience headaches? And then the patient says yes. You could then ask another question saying, can you tell me a bit more about it? There's also some open and closed question examples as well for you guys to have a look through, and feel free to use these during our sessions with OSCElink. So communication skills. So there are a lot of tips that we can give you. So listening to the patient is important. It's important to interrupt, and the patient will give you the answer in most situations. So important to take on board what they say and use that during your station to ask further questions. Important to also ask or explore the ideas, concerns, expectations. And this is definitely, or very commonly, a mark in OSCE mark schemes. So it's important to ask these three questions to the patient. Using empathy as well, important to step into their shoes, and this allows you to ask more direct and more relevant questions. Non-verbal communication is also important. So mirroring the patient's body language and maintaining a level of eye contact which is appropriate, and nodding quite frequently when the patients explain themselves. It shows that you're listening, that reinforces to the patient that, and helps build rapport. Avoiding medical jargon is also important, using words which are commonly used by patients, so that you guys are all on the same level playing field. Speaking clearly is important. You can understand each other, and also it's important in terms of the timing as well. You don't want to repeat yourself multiple times in a station which is already 10 minutes limit. So then important to be calm as well and not rush the patient. So patients might go off on a tangent, and it's important to ask and get through the structure which we've provided for you. However, at some situations, this may not be possible. And so therefore, you may have to go back and forth, but it's important to maintain the flow. And by the end of the session, it's important to cover all the aspects. And then you should be able to come and reach a diagnosis or have a good, thorough idea of what's going on by covering all the bases. So lastly, just like to say that be confident in yourself, remain calm and positive throughout. You can worry about the stations, but not in the station itself. That can happen afterwards. Just have a good mindset going in and giving it your all. And I'm sure that you guys can perform really well in your examinations. And just like to wish you guys all the best. And we look forward to having you guys practice OSCEs with us.